Hi, everybody. I'm Lindsey Smith, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. I'm truly honored to be joined by Dr. Uche Blackstock, a trailblazing physician, thought leader, and fierce advocate for health equity. Dr. Blackstock is the founder and CEO of Advancing Health Equity, an organization partnering with hospitals, health systems, and companies to embed equity into their leadership and clinical practices. You may also recognize her as a regular contributor on MSNBC and NBC News. She previously served as an associate professor in the Department of Emergency Medicine at NYU and as the inaugural director for recruitment, retention, and inclusion in the Office of Diversity Affairs. She earned both her undergraduate and medical degrees from Harvard University alongside her twin sister, Oni. Her mother, a physician, was also a major inspiration in her life, and together with her sister, they became the first Black mother-daughter legacy graduates of Harvard Medical School. Named one of Time magazine's 100 most influential people in health in 2024, Dr. Blackstock is also the best-selling author of Legacy, A Black Physician Reckons with Racism in Medicine, a memoir that dives deep into her personal journey and the urgent need for systemic change in healthcare. She currently lives in her hometown of Brooklyn, New York, with her 2 school-age children. Dr. Blackstock, thank you so much for joining us today. I'm looking forward to diving into your story and your powerful work driving equity in medicine.
Thank you for having me, Lindsey.
Let's go ahead and start from the beginning. Can you take me through your story and what first got you interested in medicine?
Oh, wow. Okay, yes. So I guess the quick answer is my mother, who I call the original Dr. Blackstock, but she grew up here in Brooklyn where I live now, but under very different circumstances. Grew up in poverty, was the first person in her family to go to college, and then she ended up at medical school, at Harvard Medical School. And, she kind of beat all the odds. And after Harvard Med School, came back to Brooklyn, New York, and practiced in the very same neighborhood that she grew up in. And so I think for my twin sister and me growing up, seeing that, you can get through the most difficult times in life and really succeed, and then also return back to your community and work in service to your community. That's a lesson that has stuck with me. And so my mother is the reason why I went into medicine.
That's amazing. And I do want to spend a lot of time on your mother. It's very clear what a trailblazer she was. And I love that she went back to practice where she grew up. I think that's incredible. So as I kind of mentioned in the beginning, you're a New York Times bestselling author with your book Legacy, who you also dedicate to the original Dr. Blackstock, your mother. And for those of you who aren't familiar with the book, I do hope you check it out. I cannot recommend this book enough. And so I think what I want to come back to, you talked a little bit about some of the lessons that you learned from your mother. Can you share a few other lessons that you learned from your mother?
Sure. I think, growing up with a mother who was a physician, when we look at the statistics for a little Black girl to have a mom who's a doctor is quite rare. So, my twin sister, Oni, and I also went to Harvard Medical School. So we're the first Black mother-daughter legacy graduates from Harvard Medical School. And I think what that symbolizes to me is that there's still a lot of work that needs to be done, in terms of representation. But I know for me, growing up with my mother as a physician and being surrounded by all of her colleagues in our community, I actually grew up thinking that most physicians were Black women. That was my reality. But I didn't realize that wasn't the reality. And so but I had this opportunity as a child to attend meetings with my mom and go to conferences and see women who look just like her doing work in our community and other similar communities and practicing what we call health equity today, at a time when we weren't even using that expression, but really thinking about what are the issues that community members face, what are more holistic ways of thinking about health, right? And knowing that a lot of what happens in terms of making people healthy is not just about what happens in the hospital or the clinic or the exam room, that it's actually a lot of what happens on a community level. So I feel like these are the lessons I learned from my mother and her colleagues that have really stayed with me for a very long time and that I wanted to make sure that I paid tribute to in legacy.
Absolutely. And I think having three doctors in one family across two generations is remarkable. So, congratulations on that front as well. I want to come back to something that you mention a lot in your book and digging into the inequities in our healthcare system. Can you share some more lessons from the book that you share and how that kind of informs your advocacy work today?
Yes, I think, a lot of the reason why I wanted to write Legacy. So Legacy, it's a memoir, so it's a love letter to my mother, but also it was a way for me to help connect the dots for people as to why in 2024, 2025, we still are seeing really like horrific outcomes as it relates to racial health inequities, looking at maternal mortality and life expectancy. And so I talk a lot about the history of, just how, racism is a part of the discipline of medicine, how a lot of experimentation was done on enslaved people and how that translates into what we see today. So we know, for example, kidney function, there are different values for Black patients and non-Black patients. Those are called race correction factors, but they're actually based on these false myths about Black people having higher muscle mass. A lot of these are deeply rooted in slavery and in our history. And what we found is that these race correction factors actually delay referral for kidney care for Black patients. We know that the National Kidney Foundation had to go back and reprioritize over 14,000 patients because of this race correction factor that made this assumption that people's kidneys were working fine when they actually were not. And so that's just one example of how the legacy of racism in medicine shows up today. And, I think for me, I talk about in medical school, I was learning about kidney function. I was learning about there were these differences, but I was never really told what's the rationale, what's the reason for these differences. And so I really wanted to make sure that in legacy and also the advocacy that I do, that I really explain to people that a lot of the racial health inequities that we see is not a result of race per se. Race is a social construct, but a result of racism, the practices and policies on a community level, interpersonal level, and how they influence the health of our communities.
Yeah, I think that's a really powerful message. And I think it comes through really strong in your book, how you've been able to kind of beautifully weave together a love letter to your mom, the history lessons and where some of these practices have come from, and then the inequities and the cycle that it creates thereafter. So thank you so much for sharing that with us. I want to talk a little bit about your company, Advancing Health Equity. I think it was founded on the belief that health is a right and not a privilege. And from the beginning, your work has been grounded in the values that drive real progress and health equity. Can you tell us a little bit more about the organization? And secondly, how you work with organizations to help them?
Sure. Yeah, I always consider Advancing Health Equity my third baby. I have two children, and then Advancing Health Equity is my third, and Legacy is my fourth. But I founded Advancing Health Equity in 2019 because I became acutely aware of how organizational culture, like what happens within healthcare and public health organizations, even within the workplace, actually not only impacts the people working in those organizations, but how we deliver care to patients, how we interact with communities. And so I wanted to make sure that, I was doing the work that had the highest impact. So Advancing Health Equity, we are our strategic consulting firm. We have about 3 buckets of work. We do trainings, we do assessments, and strategic counsel to really help partner with healthcare and public health organizations on their health equity journey. We developed a framework called House that essentially, we'll do an assessment and say, hey, this is where your organization sits on this health equity continuum. This is what you need to do to advance. And so we help them with capacity building. We help them with leadership coaching. Obviously, in the moment that we're in currently, we really want to be a trusted partner to public health and healthcare organizations who are kind of trying to figure out how do we stay true to our values, stay true to our purpose, and keep doing impactful work at a time when health equity is under attack. And so right now, that's how we're thinking of advancing health equity, as a trusted partner in helping to maybe reframe language, but still stay true to the core values. Also to help advise and coach healthcare and public health leaders in this moment who may be feeling incredibly isolated and not knowing sort of how to, what's the next step to take, but to help really support them and give them some clarity and courage. And so that's how we really are thinking about, and then even thinking about advancing health equity as a convener of healthcare and public health organizations that are trying to think about how to move through this moment in the best way possible.
Such important work. And so just to kind of come back to what you said, the trainings, assessment, and strategic counsel to really help healthcare organizations with health equity as a trusted partner. And where can our listeners go to find out more about this work?
They can follow us on LinkedIn. Advancing Health Equity is our account. And then also on our website, www.advancinghealthequity.com. And we have a really wonderful team, a multidisciplinary team, folks from organizational development and public health, nursing, and medicine, who are really committed to this work and committed to partnering with organizations, especially during this challenging time.
That's amazing. We'll be sure to share that with our audience. And I know you're also active on social media. Can you share your handles as well with us?
Oh, sure. So I'm on LinkedIn, Uche _Blackstock. I'm on X/Twitter, Uche _Blackstock, and Instagram, Uche Blackstock MD.
Perfect. We will make sure we include those with this episode. So you're doing some really important work today with your organization. Can you talk a little bit about the impact that you think your work has had so far, first off? And then secondly, I know in your book you touch a lot on the pandemic and wanted to see if you have seen any meaningful progress in health equity since then.
I talk about some of the work that we've done actually with local and state departments of health. And one of our clients, I'm really proud of the work that we've done with them, but we essentially did a training of about 5,000 staff of a health department around foundational health equity issues to make sure that we were level setting, that everyone understood kind of what the principles of health equity are, how they are integrated into their roles, and then how they can create impact. And as a result of our work with the State Department of Health, they actually made health equity a pillar in the work that they do. And so, a lot of what we do is want to make sure that the impact is sustainable, that it's not just, one training or, one strategic counsel, engagement. We really want to make sure that the work we do informs how organizations function long term. And so that's just one example of, this Department of Health that we worked with, making health equity a pillar. And as for the pandemic and, and so many of the lessons that we learned, I wish I could say that, we've come so far. I think that there were a lot of really wonderful policies that I talk about, I mentioned in the book in terms of, people being able to access vaccines and medications without having to worry about the cost, and so we see sort of those issues coming up again, that people may not always have access to vaccines without having to pay out of pocket, right? And so those are the things that still weigh heavily on my mind. I do think that there are a lot of lessons that we've learned. I wish I could have seen more implementation and sustainability over the long term. I would say that, we also saw that in states that had Medicaid expansion, people actually did better. They had better health outcomes. So again, so much that we learned, so much that we have the data for, but we really need the political will in different states to make sure that policy happens.
Absolutely. And I like what you said there on the first part about the impact that your organization has had with those trainings that you mentioned at the local and state department and making them long-term. I think that's really important. On the second response regarding the pandemic, I think that ties perfectly into my next question of when you look at the broader healthcare landscape in the US today, What changes do you think are most needed to address the major disparities that we still see today?
Sure. I always talk about like the wonderful work that the Commonwealth Fund does. They do a lot of health policy work. And some of the things that they talk about this, they are always coming out with these reports comparing the United States and our outcomes and our health policy compared to other high income countries. And there are like some basic things that we know will improve health. And that's universal health care, that's paid family leave, and that's paid sick leave. And that's something that makes us an outlier compared to other high income nations. And we know that while we spend the most on healthcare, we have the worst health outcomes. And a lot of that is because our system really is not focused on preventive care, on preventing people from getting sick, and our healthcare system is fragmented. We have had disinvestment in public health and underinvestment in public health infrastructure for years. And I think that's what we see now. So I think there are some basic policies that will make a difference. I also think that when we look at, for example, maternal mortality, that there are some things that the United States, again, is an outlier in. We have a very low OBGYN to patient ratio. We don't have midwife-centered care. And actually, a lot of other high-income countries have that. We think of birthing as something that should happen in a hospital. And in a lot of places, high-income countries, people like here would qualify for, a birthing center at home birth. So I would love for us to think about what are policies, what are practices that we see in other countries that are doing really, really well, right? And that we can do here, but we just, again, need the political will to make it happen.
I really appreciate your insights and agree entirely that there are some basic principles and policies that would make such a huge difference for the US in the healthcare landscape today. So thank you so much for sharing that. I want to talk a little bit about Osmosis. I'm not sure how familiar you are with the organization Osmosis, but our primary audience is healthcare students and early career clinicians. And we were actually founded by two med students from Hopkins that dropped out to create this platform called Osmosis. And what we're really well known for is taking really complex medical material and breaking it down into bite-sized, digestible, fun, and engaging videos. And so what I wanted to ask you today was, what do you think for our audience are some practical steps they can take today, early on in their health career, to promote health equity?
Oh, that's such a great question. I think what's important for our students and trainees to understand is that a lot of times what they're learning in school may not be everything they need to know. That you should look for other sources of accurate and responsible information. I think the other thing is to always question the why, right? So why do we see these inequities? We know that it's not a coincidence. We know that it's by design, and we need to understand how systems work and produce these inequities. So I would always, challenge them, question the why. I would try to look for, experts to follow in health equity, looking up evidence-based articles about health equity. And then also, I think another thing that's important is really interfacing with community groups on a hyper-local and local level. I always encourage healthcare students and trainees to think about what's happening in their neighborhood or what's happening in a community that their hospital is serving, and really understanding the needs of the community, because it may be different than what the hospitals think are important, right? The people living in the community, they say, we just want to be able to work out outside, but we don't feel safe, right? Or, yeah, we'd love to eat more healthy, but we don't have access to healthy foods. And so I think really understanding the needs of the communities we serve is important.
That's excellent advice. And just to play that back, a lot of learning happens outside the classroom. Question the why, follow the experts with reliable news sources, and really get to know the community groups that you're serving. I think that's really great advice. So thank you so much for sharing that. As someone who really can appreciate someone wearing a lot of hats, you wear a lot of hats: physician, author, mother, sister, founder and CEO of Advancing Health Equity, prominent voice in the media as well. And my question for you is, with so much on your plate, how do you stay grounded and manage it all?
I know, I will admit that it is a challenge. It's not always easy. I try to be very intentional about what I say yes to. So if I say yes, it has to be like a very enthusiastic yes, right? Because I could be busy like every single day, every single minute, right? But so I'm just really thoughtful about like, what I say yes to and what I say no to. And then also just sort of making time for myself to rest and restore and just making sure that I'm intentional about putting that time to my schedule. And I also have a really wonderful therapist that I see every 2 weeks for the last like 6 years who's been amazingly supportive and validating and affirming.
It's very impressive from the outside to see how you juggle it all with such grace. And we are so glad that you said yes to join us on the podcast today. What is next for you?
I know. What is next? Well, one, I think this moment that we're in, is a challenging one. So I really am focusing on, you know, advancing health equity and growing its impact and making sure that we're connecting with the organizations that we need to connect with just to help support them. So that's one thing. The other thing is I am working on a second book proposal, and I never thought I would want to work on a second book after my first book came out, because just the process of writing, and then also I didn't realize also 80% of writing a book is like the marketing piece, like pushing out the message of the book. But now I'm ready. So I'm working on the second book proposal. So very excited about that. So hopefully next year you'll hear about my second book. So really excited about that.
I was hoping you might say there was a second book in the works. So we will definitely be on the lookout for that one and look forward to reading that.
Yeah, thank you.
Before we wrap up today's episode, is there anything that we haven't covered that you'd like to share with our listeners?
I think that what I would say is I think sometimes when we look at the healthcare landscape and look at sort of all the issues we have, it can seem really overwhelming. And so what I always encourage our young people to do is, maybe find one or two areas that you can focus your time and attention on. Like I mentioned earlier about community-based organizations, like maybe find an organization in your neighborhood that's doing maybe work around housing insecurity or food insecurity, and maybe like just work with that organization, volunteer, help amplify their message. So, a lot of times when we're so overwhelmed, I think it's good just to find one or two areas to focus our attention on.
Great advice for our listeners. The healthcare landscape is overwhelming. And so I think it's great to recommend that we find one or two areas to focus your attention on and really dedicate and kind of dig in with that organization to make a difference. We're so grateful for your time today and for the example you've set. Thank you so much for joining us today.
Amazing. Thank you for having me.
Dr. Blackstock, thank you so much for such a powerful and inspiring conversation. From being initially inspired by your mother's legacy to now drawing strength from your own children, it's clear that your work is deeply rooted in purpose, and it shows. Through Dr. Blackstock's advocacy, storytelling, and leadership, she's not only challenging the status quo in healthcare, but actively helping to create a more just and equitable world. Dr. Blackstock's perspective isn't just eye-opening, it's essential. In her book, Legacy, she offers a powerful playbook for the path ahead. It's both a call to action and an urgent reminder of the work still needed to dismantle inequities, rebuild trust, and create a future where everyone has the opportunity to thrive. And to our listeners, thank you for joining us. Be sure to check out Dr. Blackstock's memoir, Legacy, and follow her ongoing work at Advancing Health Equity. Until next time, I'm Lindsey Smith. Thanks for checking out today's show. Remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelines podcast.